Live from Cincinnati, this is Medicare 101 from ARC Benefit Solutions, Cornerstone. I am Rose Flores, and this is
Aziz Rahman. Thank you for joining us.
Check out the nice voice, okay? So we're going to do kind of a high-level look at Medicare 101. I got a little case of butterflies, kind of my first, so we'll just go with it, and we hope you all have fun and have plenty of questions as we go through these, okay? So, as they say, on with the show. So, thank you. Oh, we have little graphics. Thank you. So there are some housekeeping deals. We do want you to put your questions in the question box so that, we can answer any, scenarios that you have. And usually we'll answer those at the end of the presentation.
Yep. Right in the chat box there.
Hey. Okay, here's Aziz and I, these are pictures taken about 4 years ago, so you'll notice my hair is different.
Mine's not.
And we may look a little younger, okay? So, and then we want to let you know that we do have a monthly newsletter that's out there, keeps you on the latest and greatest with ARC Benefit Solutions. And so just make sure you keep an eye out for that. And then here's a little bio about me, nothing overly exciting, but...
She's an all-star, folks.
But we do have a lot of fun. Yeah, I am a home brewer. Yes, I've got dogs. I love gardens. So Aziz, why don't you tell them a little bit about yourself?
So I've been in the health insurance industry for, about 10 years. And been selling individual health insurance, Medicare health insurance, in my spare time. Just like to spend time with family and friends, movies, sports, basketball, football, that type of thing. So pretty simple, pretty straightforward.
You've got a lot more personality than I do.
Supposedly.
Okay.
We'll see about that.
So here's the agenda for today. So we're just going to kind of do these one at a time. Not going to get too deep in the weeds. But if you do have questions, we'll try to address those. Otherwise, you can always just reach out to us and just, ask us questions on a personal level.
Yeah, that phone number at the bottom is a good toll-free contact number, the 833-342-5272 number. We also have local numbers as well, but that's a toll-free good number to reach us.
Awesome. Thanks, Aziz. So we're going to kind of go over the Medicare overview. It was signed into law in 1965 by President Lyndon Johnson. In 1972, it was expanded to cover the disabled. In 2003, the Medicare Modernization Act got Part C into Medicare Advantage and created the Part D, but the Part D didn't really start until like 2006. And then in 2021, nearly 63 million Americans do have Medicare, and a good portion of them are on Medicare Advantage. So let's just kind of go in. All right, so Medicare eligibility, there's a lot of ways to be Medicare eligible. You can turn age 65, you can be on disability for 2 years or 24 months, and when you hit the 25th month, usually Social Security will send you out your Medicare card. You can be over 65 and lose employer coverage, so you don't necessarily have to enroll in Medicare when you turn 65, and we're going to kind of go into that a little bit later in the presentation. So depending upon the plan type, whether you have a Medicare Advantage or a Medicare Supplement, you do need to have both Medicare Parts A and B, and we're going to go into what those actually are. Okay, so here's the basis for Medicare. Medicare Part A basically covers you when you're in the hospital. It does do skilled nursing, it has hospice, some home health care, and then Medicare Part B is usually like doctor visits, outpatient, surgeries, some supplies, durable medical equipment, preventive services.
Folks, if you ever hear the term, sorry, I didn't mean to scream in your ear.
Fine.
If you ever hear the term original Medicare, that refers specifically to Medicare Part A and B together. So if you ever hear original Medicare, that's Part A and B together.
Awesome.
Please continue.
Thank you. All right, so what do you need to have to get Medicare Part A? And Medicare Part A, for most people, if you've worked 40 credible quarters or 10 years, there really isn't a premium for your Part A. And even if you're, married and the spouse is not having those working hours, then you usually can get it through the spouse that is employed. So don't worry about that. There are deductibles and copays for hospitalization, skilled nursing. So Medicare itself, whether it is A and or B, is kind of like Swiss cheese. There are some holes to it. If you are collecting
Sounds delicious.
We've already had lunch.
Yeah.
Okay, so
Delicious too.
yeah, that was good. If you are collecting a Social Security benefit check, they, being Social Security, and oh, by the way, Social Security is the administrator for Medicare. So you're going to hear us kind of blending those two together. They will automatically send you out your Medicare A and B card. You do have the ability of saying, hey, I don't need B, but they will automatically enroll you definitely into A. And if you are not getting a Social Security benefit check, you pretty much have to say, hey, Medicare, Social Security, I would like to retire, because back in the day when you turned 65, it was almost like your birthday card, you got your Medicare card. But that's not really the scenario today, other than if you get a Social Security benefit check. And, as far as I personally am a 1957 child, so I am one of those lovely baby boomers turning into Medicare.
It's a big year.
It is. We recommend that you start the process at least 3 months in advance, because in 1957, there must have been a huge baby boom, and it does take them a while to get the information to you. So let's go on into this. So here's Part B. Unlike Part A, Part B does come with a premium. So the base premium is going to be $170.10 each month, and this is a per person premium. Based on your income, whether you are a single person or filing jointly, you could have a higher premium for Part B, or a lower premium if you do qualify for Medicaid. Part B does cover outpatient services, doctors, labs, durable medical equipment, emergency. In 2022, the Medicare Part B deductible is $233, and that does change on an annual basis. And usually they don't release that number until, say, the end of December, first part of January,
right.
So it's kind of last minute. And then once that deductible is satisfied, you do pay 20% for all services that are not preventive. Unlike a group plan, normally when you have a group plan, you have a out-of-pocket maximum. So let's say your out-of-pocket maximum is $5,000. Then when you get to that out-of-pocket maximum, you're covered at 100% for the rest of the year. Medicare does not play like that. That 20% can go on and on and on. So it's very important that you do think about having some additional coverage in addition to the basic Medicare. Okay? And there, like I said, there's no limit. So there we go. All right. So here's kind of a look at what you're going to pay for Part B. And you'll notice that here on the first portion, it says, if you're individual, it's $91,000 or less. Filing jointly, $182,000 or less, and there's that base premium, and that is, as I said before, per person. But you'll notice that as your income goes up, they will give you a surcharge based on your income, and your income is based on 2 years ago. So, go ahead.
So this year, it would be based off of 2020's income because we're 2 years away. Next year, it'll be based off 2021's income.
Perfect.
If I understand that correctly.
That is correct. And let's say if, for instance, you've been working and making a good amount of money and then you decide to retire, there are forms that you can send to Social Security and say, hey, I'm not making that kind of money, and they will adjust it to reflect a more current amount, okay? So you've got two choices, and they are very, very different. So a Medicare supplement, these are plans where you pay a premium, not a whole lot of copays. You can see any doctor that accepts Medicare. A Medicare Advantage is almost a 180, very much like a group plan. You're going to have copays like a pay-as-you-go. You're going to have out-of-pocket maximums. So we're going to kind of go into the two different types of plans, and there really isn't a bad choice. We're just going to tell you to explain the difference.
And by the way, folks, when you get close to turning 65, you're going to get bombarded with a lot of mail and a lot of information trying to explain all these different options. Really, it just comes down to these two options, either a Medicare supplement or a Medicare Advantage after you've established your A and B. So all that complicated stuff, it really just comes down to these two options.
Perfect. Thank you, Aziz. All right, so the two main routes, you can do a Medicare supplement and a standalone prescription drug coverage, because a Medicare supplement mirrors everything that Medicare covers. And Medicare itself does not cover medications that you get from a pharmacy. So you really do want to marry those two together. A Medicare Advantage plan can come with prescription drug coverage. You have lots of options depending upon, you know, when you go in, as far as where you live. I mean, there's just a plethora of options available to you. And unlike, you know, when you're in a group plan, you are really in charge of finding a plan that fits your needs. As we said before, these plans are very individual, so it's not a husband and wife plan or a family plan. Each person will have their own plan, and what fits one person may not fit another. So that's why they give you all these good options, okay? So Medicare supplement, we're going down the one path, all right? So it fills in the gaps of original Medicare, like deductibles, coinsurance, and copays. So there are some pretty hefty hospital copays that are out there, and coinsurance and all of those good things. There are plenty of plans or companies that offer a Medicare supplement. Like I said before, you can go to any provider that accepts Medicare. It travels really well. So if you happen to be a snowbird, as we call them, and you live in Ohio, and I saw that, and you live in Ohio.
There's no snow out at 80 degrees.
And then you want to go to Florida or the other way around, or you want to chase grandchildren throughout the states, then, you know, a Medicare supplement might be the way to go for you.
Well, now, would you say that most doctors and hospitals in the country take Medicare, or
yes.
Are there a significant amount that don't? Or
no, most doctors do. There are a few doctors which are, I would say, like a concierge doctor, where you spend a certain amount of money to see that doctor. But you still need Medicare coverage because, you know, going to the hospital, physical therapy, you know, that concierge doctor may not be able to cover those services or take care of it. So, and then the plan is the plan is the plan. So the federal government has come up with a list, and we'll show you that shortly, of the different types of plans available to you. But from carrier to carrier, Plan G is a Plan G from one carrier to another. There might be subtle tweaks, whether you have a household discount. If you and your husband or wife, you know, go into the same plan, you could save some money. There may be some gym memberships, some vision discounts, but the bare bones, you know, outline of the plan is exactly the same. There is various prices for them based on the insurance company, the location, what your age is, you know, male, female, you're a smoker or not. So we're going to go ahead.
And the words Medicare supplement and Medigap are interchangeable.
Right.
They mean the same thing.
So Medigap is Medicare, they fill in the gaps of the coverage, like the Swiss cheese, which we had for lunch.
Yes, amazing.
Okay, so we're going to go in and look at the different types of plans. And these are all set up by the federal government. So if you have a Plan G, it's going to be running just like the Plan G. This HD is a high deductible Plan G, okay? So there are different types of plans, but they have to abide by the rules that the federal government has put out there. So back in the day, the majority of the people who were going into a Medicare supplement were into a Plan F or a Plan C, but things have changed, and as of, I believe it was January 1st of 2020.
2020, yeah.
The federal government said that if you're brand spanking new to Medicare, you can't go into a plan that has first dollar coverage, which means you don't really pay anything initially. So the Plan G as well as the Plan N, as of that date, have become big hot sellers. Wouldn't you agree?
Absolutely.
Okay, perfect.
Awesome.
All right. So we're going to go and move into the prescription drug coverage. Okay. So Medicare Part D is basically the medications that you get from your pharmacy. It's available to all people with a Medicare plan. There really aren't any underwriting rules or anything going on with that. You can have a standalone prescription drug plan that goes very well with your Medicare supplement, or you can have just your Medicare A and B and have a prescription drug plan, or you can have a Medicare Advantage plan that has the prescription drugs embedded into that plan. And Medicare Part D is based on service areas. And you may sit there and say, well, what is a service area? Well, the state of Ohio is actually a service area. The states of Kentucky and Indiana are a service area. So if you're going to move from one state to another, you can keep your Medicare supplement, but on the prescription drug side of the fence, you would have to get a new plan for that new service area. So, for instance, I had today somebody who moved from Pennsylvania to Ohio, so we did an enrollment into a new plan for them. And the plans do vary by the county, the pharmacy network, drug formula, pricing details, deductibles. It's really kind of a mixed cocktail of, you tell us what your medications are, we put that in there, and then we can advise you as to, what would be a good choice for you.
Cost effective.
Mm-hmm. Exactly.
Within your budget.
So just like on the Medicare Part B, which was the hospital, which was the doctor and outpatient, the federal government has indicated that if you are making more money, you're seeing the same basic chart that we showed before, then you will be getting a surcharge. Now, the surcharge that is being shown here, like the $12.40, the $32.10, that does not go to the carrier. That money goes directly to Social Security. So if you're making less than the $91,000 as an individual or $182,000 filing joint, you're just going to pay the normal plan premium. And Aziz, what would be the range for Part D premiums?
So we've seen premiums as low as about $7 a month and all the way up to maybe $100, $120 a month. So within that range, you'll have 45, 50 different plans per county. So depending on somebody's prescriptions and their pharmacy and that type of thing, some of those plans are going to be more cost effective than others, but that's kind of your premium range.
Super. Okay.
And now would you say basically if someone's paying a surcharge for their Part B, most likely they're also going to pay a surcharge for their Part D? Would you say that's a pretty fair assessment? Yeah,
the chart is on the income levels here is exactly the same.
Okay.
So you could get hit on both. So, and then we're going to transition from the Medicare supplement to Medicare Advantage and kind of go through how those plans roll and how they work. So let's go into that. All right, so Medicare Advantage, which is also called Part C, You do have to have A and B, and it will include D. So it's just another way to, get your Medicare coverage. You're still going to be in the Medicare program. You're still going to be paying your Part B premium. So the difference here is that the private companies are actually going to manage your care, okay? So instead of everything going to Medicare for them to review and approve, it'll go to the carrier instead.
Sometimes people use the word Medicare replacement. You're not really replacing Medicare, but whenever someone says that, typically they're talking about a Medicare Advantage plan. The Medicare Advantage plan pays instead of original Medicare, so it's not replacing, it's just your benefits are administered differently.
Oh, and by the way, like I said, you do have Medicare A and B, so don't get rid of your Medicare card, because some people say, oh, if I have my Medicare Advantage plan, I don't need my Medicare card. That's not the case.
Definitely want to hold on to that. Absolutely. Definitely want to hold on to that.
Definitely. And so Medicare does, because Medicare is saying, insurance carrier, you're going to take care of my beneficiary, and anybody who's on Medicare is considered beneficiary. Then Medicare, or Social Security, is going to pay a fee to the carrier to manage your care. And it's pretty significant. So, and based on that, they have a tendency to put little buzzers and whistles and things in there. So it is similar to group coverage. So it is copay. It's more of a pay-as-you-go type of scenario. There are HMOs, which is a health maintenance organization. And as we know, those are plans where you do need to stay within the network. If you go out of the network, it's your cost. And then a PPO will give you the ability to go in or out of network. Obviously, you're going to get more bang for your buck if you stay in network. Okay, good. I'm glad you agree.
I hope I agree after being in this industry for this many years.
So, and these...
If I don't, that's a big problem. So.
We're going to retrain everybody. So, there's a lot of different plans based upon where you live. There are no medical questions. So it's, it's kind of easy to get into one of those plans, but they do have certain times when you can go in those plans and or switch those plans. All right. So on a Medicare Advantage plan, you receive all your care under one plan. So your hospital, your medical, and your drugs covers everything that original Medicare covers. So you're going to have co-pays, preventive services, really on an in-network basis, which really should not be at any cost to you. Though when you're thinking about preventive, just remember that the shingle shot and a tetanus shot is not considered preventive based on the government. I have my own opinion on that. And then some of the things like durable medical equipment, chemotherapy, Part B drugs, you would have a 20% coinsurance. But because the government is giving them this surplus of money, they will throw in like dental, vision, hearing, fitness, over-the-counter, transportation. And in some cases, I think if you have a chronic condition, some of them are giving you like $100 towards groceries a month.
Yeah.
So
extra benefits, yeah.
Yeah, I mean, it's really, the plans are getting better and better every year, okay? So let's kind of look at, well, what about the supplement versus the advantage? So when we're looking at kind of a side-by-side scenario here, the supplement is going to have higher monthly premiums because you're really not going to have copays other than that $233 calendar year deductible for Part B services in 2022. Advantage plans typically have lower premiums. You can get one that has, many of them have $0 premiums, but they can go up, and there are some that can be pretty pricey. On the supplement, the premiums will increase every year based on you getting 1 year older. The premiums on the Advantage plan usually stay steady, but Medicare does have the ability to review their plans, so they may tweak those premiums, but it's usually not a whole lot. And then on the supplement, other than that little $233 deductible for Part B, there are really no copays or out-of-pocket expenses. But on the Advantage plan, you do have copays and higher out-of-pocket expenses. So you're really kind of weighing one versus another. Do I want to pay a bigger premium or do I want to pay copays? So on the supplement, you can go to any provider. On the Advantage plan, yeah, you do have to stay in network, especially on those HMOs.
Right.
And then on the supplement, it does not include drug coverage, so you do need to get a prescription drug plan. Whereas on the Advantage plan, the drug coverage is included with most of the plans. So the plan benefits on the supplement really never change. They're pretty much etched in stone. The benefits on the Advantage plan can change from one year to the next year. So, you know, just because you're in one plan and you like that one plan, if that plan changes, you can shop or just go with the changes that are available. So on a supplement, you may have medical questions if you are not in a guarantee issue or coming off an employer plan. And then on the Advantage plans, you're not going to have any medical questions to answer. So let's look at the difference and kind of what the prices would be. Obviously, the Medicare Part A is at no cost to you if you work those 10 years or 40 credible quarters. Medicare Part B, obviously, we're putting in the base amount of $170.10, and yes, that is per person. A Medicare supplement can be anywhere from 100 to 120 to 200 based on your age, smoker, that kind of thing.
Right.
Whereas an Advantage plan, I think that it's like a 0 to 150. I think some plans have been more expensive.
180 maybe we've seen, yeah, in the past. Not too many, but there are some.
Yeah. And then Part D, those plans, as Aziz had said previously, can be anywhere from $7 to $100. And usually on the Medicare Advantage plan, that premium is already built in on the Advantage plan. So when we're looking at the total cost, yes, it is a little bit more expensive to be on a Medicare supplement and Part D as far as premiums are concerned. But remember, you have very little out-of-pocket for hospital and doctor services. You're still going to have those co-pays for prescriptions, but for the most part, you're not going to really see big bills like if you went into the hospital. Whereas on the Medicare Advantage, you're really looking at just the Part B premium, and there may be a premium for the plan.
Right.
And then, of course, the drugs. And then some of these premiums, wouldn't you agree, Aziz? I mean, some of them are maybe $20, but versus a $0. But usually, if you pay that $20, you usually have a lower out-of-pocket.
Right. Your benefit's a little richer.
Yeah.
Yeah. If you're willing to pay a higher premium on the Advantage.
Okay. So let's kind of find out, you know, how do I get into this? So a Medicare, the qualifications for enrollment, Medicare, anyone over the age of 65 and has A and B. You can be guarantee issue when you turn 65 or loss of group coverage, as we said before. And if you don't meet those particular guidelines, then you would have to qualify medically to enroll. On a Medicare Advantage with prescription drug, that's what that MAPD stands for, you can really be any age. You just have to have A and B. So a lot of people, specifically if you're on a disability, wouldn't you say that Medicare Advantage is more of the way to go?
Especially depending if the state rules only allow you to sign up for an Advantage plan. But yes, I think Advantage makes sense for a lot of those folks who are on disability under 65.
Right. So there's no health questions. Enrollment is limited to qualifying events, and we're going to go through all of those little different situations. And the plans can change every year during the annual election period. So we're going to go in and see what are those election periods, okay? So your initial enrollment period is a 7-month window. It's 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after that.
This is typically right when you turn 65, about to?
Yeah. So when we were talking earlier about, get in touch with us 3 months before, because we want to make sure that when you turn 65 and or come off of group, there's no break in coverage. So we want to make sure that that goes well. And then, of course, you're not, stuck like Chuck into the plans, especially the Medicare Advantage and the prescription drug. You really don't want to change the Medicare supplement because that plan doesn't really change. It's, kind of, and then if you did want to change, you'd have to go through underwriting, and some people might not be able to do that. But the normal annual election period is from October 15th through December 7th, with the effective date being January 1st. We always recommend that if you are thinking about changing, that you get in touch with us early, because the closer we get to this deadline, the harder it is for us to take
early October. Get in touch with us early October. That's when we get all the information, early October.
That's it. And they don't give it to us the day before.
Right. September 30th, we won't have any information.
They really hold those cards close to their chest. And then, of course, there's special election periods. So if it's kind of any time during the year, if you move, like my people did, from Pennsylvania to Ohio, that opens up an election period. If you become eligible for Medicaid, if you, like most people, of course, that would be me, I'm going to work longer, than 65, but I'm expecting a nice party on my 65th, okay? I'm just saying. So, hint.
Here? Okay, memo.
But if you are going to work longer, like I am, then you can enroll once you are no longer on an employer plan. And there are, kind of some rules about that. If you're on a group plan that's less than 20 people, you want to enroll into Medicare when you turn 65. If you're on a large group plan, you want to delay it, especially the Part B, because when you're going into a guarantee issue coming off of an employer plan, they are going to look at that Part B effective date, and you have like a 6-month window of guarantee issue to go into a Medicare supplement. So that's kind of a triggering thing. Yeah. So, and then, okay, how do you enroll? Well, you can always reach out to Aziz and I. Yay! And we give you more of a personalized assistance, more consultative. You can ask us all kinds of questions and
easy questions. Unless you want to ask her a hard question. Take the easy ones for me.
And then, of course, you can always go directly to the carrier website or and call them up. And then, obviously, you can enroll through Medicare.gov. Of course, we're a little biased. We like you to call us.
Absolutely.
Who would want us, Okay. So, all the time people, and I'm sure you get this too, well, what is the best plan for me?
Right.
Well, Medicare doesn't allow us to use that 4-letter word, best. So basically, we really listen to how your lifestyle is. What's your income? What do you want to do? What do you need? Do you need that extra dental, vision, hearing type of thing? And then we're going to look at, your address. So the plans in Pennsylvania are different than the plans in Ohio. What your income is, can you afford the supplement, or is the Advantage plan a better choice for you? We want to make sure if you're going into an Advantage plan that that particular plan does have your doctors and providers in the network. We're going to check on your medications to make sure they're in the formulary, see if there's any restrictions, prior authorization, quantity limits, and at the bottom, at the end of everything, it really depends on your budget.
So is it conceivable that one spouse may have a certain plan, but another spouse may have a completely different plan based on their individual needs?
Sure, definitely. And I have lots of clients that are that way. You too?
Here and every now and then.
Yeah.
But
Okay, so here's my mug yet again, and here's our telephone number. This is my direct line and my email, so if you want to get in touch with me. So now we're going to open it up to questions, and I have my lovely assistant, Jess, here in the background. And she is going to help me with the technical piece up here.
Yes.
Okay.
All right. We do have a few questions here that we're kind of ready to go through.
Okay. What's this? Privately? See, I'm not the techie. I'm just saying.
All right, that's the only question you got so far.
All right.
Well, thanks, Teresa. I appreciate that.
All right. So, first question we got here. Is there a way to get onto Medicare before I turn 65?
Of course. If you are on disability for at least 24 months, on the 25th month, Social Security will enroll you into Medicare Parts A and B. But again, you want to get in touch with us so we can help you with that Advantage plan.
And also somebody who's been diagnosed with end-stage renal disease, which is the last stage of kidney failure. It's a horrible condition. If someone has that diagnosis, then typically how long they get Medicare right away? Is that, do you remember that?
Yeah, I think their waiting period gets shortened, and they can go back in time on that disability. So yeah, that does really happen a lot. So we're good with that, and we can help you with that. In fact, I have someone right now who's going through dialysis.
And they're under 65 years old.
Yeah.
All right. Next question, can you give me an example of what kinds of medical questions will be asked on a Medicare supplement application if I have to go through the background check?
Okay, they're going to ask, obviously, the big ones. Have you had a heart attack? Do you have cancer, rheumatoid arthritis?
Diabetes.
Yeah, diabetes. You know, they're really not looking for the little things, but they are looking for the big things. And if you do have, you know, one of those conditions, usually you can't switch. So if you're on a Medicare supplement, you may want to stay on that, or you may want to consider a Medicare Advantage plan.
Absolutely. Very good. And next question, it says, is it easier to switch from a supplement to Advantage or from Advantage to a supplement?
A supplement to an Advantage. That would be the way to go. There's some scenarios that are out there. Don't want to go too deep into the weeds, but you know, when you're going from a Medicare Advantage plan into a supplement, they're going to ask medical questions, okay? Whereas if you're going from a supplement to a Medicare Advantage plan, they're not going to ask you questions. And there are trial right periods that you have that you really need to talk to an agent to get more information about that. Yeah.
Absolutely. Okay. Another question came in here. Do insurance agents and brokers charge a fee for their services? If they don't charge a fee, how are they paid?
Good question.
So we don't work for free. Is that what you're saying?
No, we do work for free. So as far as, you know, our clients are concerned, there is no real fee that we charge you. We are paid by the carrier. And of course, we represent a lot of carriers. So when we're looking at plans for you, we're looking at plans that fit your needs. We're not going to put you in some fly-by-night plan that's, you know, luring you with a really low premium, and then 3 years later that's going to go skyrocketing. We've been, you know, Aziz and I have put in a lot of years here, and we have a good track record of knowing, you know, which carriers are the better plans. But, you know, we open up the door to all the possibilities to make sure that you're in the right plan for you.
Absolutely, very good. And I think that's all the questions that I'm seeing for now. One thing I would just reemphasize to what Rose said. Again, folks, you want to pick the plan that's based on your circumstances. Your best friend, your neighbor, even your spouse may like their plan or may work well for them specifically. But remember, you want to pick the plan that's going to work for you, that's cost effective, has your doctors in network, covers your med. So that's why we try to individualize this as best as we can, or as much as we can, for your specific situation.
And one of the questions that I get from, you know, calls is that, well, my neighbor told me I should do this,
right,
and I have to do this, or I have to do that. Call an agent, because we know what the rules are, and we can advise you.
Absolutely.
You know, I know everybody out there thinks that they're the, you know, the Medicare expert, but you know, there are a lot of rules.
There's only one Medicare expert, and you're looking at it.
There's a lot of rules out there. So we want to make sure that you're doing the right choice. We've had people spend more money than they needed to just based on incorrect information. So here's just one question answer-ish thing out there I want to put in there. So there's quite a lot of people that say, should I stay in my group plan or should I go to Medicare? Mm-hmm. Okay. So there's a lot of things to consider. If your wife or your husband is on the plan and they're younger than you, you may want to delay that Medicare. If the plan is a small company, you may want to go on to Medicare.
Because if you delay it, it keeps them on the group plan.
Right.
If you leave it, then they're not eligible to stay on the group plan.
Right. There's some times where you can have COBRA, but the majority of the time, the employee must be on the plan for the spouse to have coverage. And then, there's COBRA, there's individual plans, there's all kinds of little things out there. So there are many times people call us and say, hey, I was told I needed to do this. And then so we go through a variety of, questions to say, okay, well, tell me about it. And then it might be at the end of the day, we say, no, you can stay on your group plan, you're fine. But when you do want to come off, give us a call, okay?
Absolutely.
All right.
Great.
So, okay, and here's another question that we did put. Can I just stay on A and B, and why do I need this additional coverage? Well, A and B, like we said in the beginning, that 20% can go on into infinity, and I did put that right in front of your face.
All right. I don't see any bruises.
So we want to make sure that you are financially, not at risk, because of course we are agents, and that's what we want to do is make sure that we reduce your risk. So always, as we said before, you do have to have A and B, but when to get on A and B, and why to get on A and B, and what you want to do in addition to those, give us a call and tell us what your situation is. We listen, we're never more than a phone call away, and we work a lot.
Most definitely.
I hope you're hearing this, Luke. Luke is my boss. So I hope that we have answered. I'm trying to go in here. I really don't. Oh, donut hole. Oh, what is a donut hole?
How about it?
I used to work for Daily Donuts back in the day, okay? And I used to make the donuts. I decorated the donuts, okay? So I lived with donuts in my earlier time, and now I'm circling back and dealing with donuts again.
You just can't get away from donuts.
I know. What's up? So the government has set up this basically donut hole where there's a deductible, and then there's co-pays.
And this is only on the drug coverage.
Yeah. So a carrier can decide if they want a deductible or not. If they do have a deductible, your premium is usually lower. If they don't have a deductible, your premiums are going to be higher. And then once the deductible is satisfied, you'll either have a copay, which is a flat dollar amount, or coinsurance, which is a percentage, up until you get to a certain level. And that's when you enter that donut hole, which back in the day had nothing. But now they've gone to the point where once you hit that donut hole, you pay 25%. And then when you get out of the donut hole, then you'll pay either 5% or a very low copay. Right. And those benchmark numbers change every year, and it really depends on what kind of medications you have.
Exactly, right.
Is there anything else you want to add, Steve?
Donut hole there's 4 phases to your drug coverage. The donut hole, the official term is called the coverage gap. It's the 3rd phase of your coverage. So just FYI, and again, you don't have to get bogged down with that. We'll go over that with you. But if you ever hear that term, just keep in mind it relates to prescription drugs, and it's the 3rd phase of your drug coverage. Mm-hmm. So,
and we have really cool software that kind of explain all of it and everything. So just give us a call. I hope this presentation has been beneficial and we didn't get too far in the weeds for you. But as we cannot help but say, if you have any questions, please reach out to us so we can assist you. And if you have any friends or family that can need our service, we love that. All right?
We also have a page on Google, ARC Benefit Solutions, so if we've done a great job, we would love to have a star rating and review of your experience with us. So please feel free to Google our agency and give us a review.
Please spread the good word. Hope you have a great day, and thank you for attending, and give us a call. Have a good one. Bye.
Thanks, everyone.
Thanks, Aziz.
Enjoy the beautiful weather.